Hi everyone, this is JP Singh. I welcome you all on my channel Medico's Maharathi. Hope you all are happy and healthy. My dear friends, our today's session is image-based dermatology session. Today we are going to discuss dermatology on the basis of images, and these images are completing our one complete topic. Okay, so we are going to cover one topic of dermatology today, and this session is targeting every upcoming exam, whether it is FMGE for December 2022, INICET for November 2022, or you can say NEET PG for 2023. This session is targeting every upcoming exam, and this session is totally based upon our current pattern of examination. In this session, we are going to cover some of the PYQs also based on our images. Okay, my dear friends, and I hope that you are working properly, you are studying consistently. If you are doing your job consistently in well-mannered pattern, if you are well devoted, if you are positive, if you are believing in yourself, and if you are going well with your preparation and studies, then you are surely going to crack every upcoming exam for what you are preparing with. Okay, so my dear friends, let's start our today's session, and here we go. So my dear friends, here you can see a question in front of you, and it is previous year asked question. You can see a young girl presented to OPD with patchy hair loss for 2 weeks, scarring or erythema, as shown below. What is likely cause? So here you can see patchy hair loss. So examiner is asking what is likely cause. So my dear friends, the cause will be option number A. It is a condition named as trichotillomania. Trichotillomania, it is a psychiatric condition, and we can see hair loss in this condition, and this psychiatric condition mostly seen in females. In this condition we will see hair loss, a patchy hair loss for a localized area. We can see here that a patch and complete hair loss for this complete localized area. एक ये localized area है, इसके लिए एक patch है, और इस patch में क्या देख सकते हो आप, hair loss हो चुका है. And we can see here different length hairs. Okay, साइड में क्या है, बड़े hairs है, यहाँ पर क्या है, totally hair loss है, और कुछ आपको hairs यहाँ पर दिख भी जाएंगे. ओके, सो ये कंडीशन किस में दिखेगी, फीमेल्स में. हमारा करेक्ट आंसर क्या है, ट्राइकोटिलोमानिया. ऑप्शन नंबर बी क्या है, एलोपेशिया एरियाटा. एलोपेशिया एरियाटा एक क्या है, ऑटो इम्यून कंडीशन है. ओके, एंड इन दिस वी विल आल्सो सी पैची हेयर लॉस. ओके, एक स्मॉल पैचेस. ओके, वी कैन सी हेयर लॉस इन स्मॉल पैचेस, और यू कैन सी इन ओवल लाइक पैचेस. ओके, इसमें एक बड़ा लोकलाइज्ड एरिया है, पर इसमें लोकलाइज्ड एरिया नहीं होगा, इसमें डिफरेंट पैचेस दिखेंगे आपको. हो सकता है एक ही पैच दिखे, लेकिन वो होगा एक छोटा साइज का ओवल पैच. दैट इज कंडीशन नेम्ड एज एलोपेशिया एरियाटा, और ये क्या है, ऑटो इम्यून कंडीशन है. तीसरा है टीलोजन एप्लियम. टीलोजन एप्लियम, इट इज अ कंडीशन ऑफ हेयर लॉस where we can see this condition 3 months after pregnancy. Okay, 3 months after pregnancy, where the mature hair follicles enter into telogen phase. Tinea capitis. Tinea capitis, it is also a condition of hair loss where we can see scarring and non-scarring condition. Okay, we will discuss about all these options further in our video by different images. Now let's go to our next phase. So my dear friends, as I told you, what is trichotillomania? Trichotillomania क्या है, एक psychiatric condition है, mostly seen in females. We can see patchy hair loss for a localized area. Okay, for hair loss in accessible area. Friar tuck sign. Friar tuck sign, it is an important sign associated with trichotillomania. It is a non-scarring alopecia. Okay, non-scarring hair loss, and we can diagnose it using skin window test. Okay, skin window test हम past में use करते थे, present में we are using or we are diagnosing it using histological examination, where we can compare it like no inflammation as alopecia areata, perifollicular hematoma or hemorrhage seen, trichomalacia where soft incomplete keratinized hair shaft can be seen. Okay, and we can see here different lengths of hair. Okay, जिस एरिया में लॉस होगा वहां पर हेयर की लेंथ कम हो सकती है, आसपास हेयर की लेंथ क्या हो सकती है, ज्यादा हो सकती है, and perifollicular hair granules are seen. Okay, my dear friends, now let's go for our next discussion. Now we are going to see pattern of hair loss in male and female both. So here female pattern hair loss. So in female we can see Ludwig pattern of hair loss. So it is Ludwig classification system. In females we can see Ludwig pattern of hair loss. So here you can see, my dear friends, that front line in every image you can see the front line is maintained. Front line is maintained in every image you can see. So in female we will see that there is no hair loss from front line. Okay, at the end of stage you can see the hair will loss from front line, but it is very late stage. Okay, so what kind of hair loss we will see? We will see mostly the hair loss from partition site. जो ये बीच की पार्टीशन साइट है, जो डिवाइडिंग साइट है, ठीक है, वहां से क्या हो रहा है, हेयर लॉस हो रहा है फीमेल्स में, ठीक है, पर मेल्स में ऐसा नहीं होता है। मेल्स में कहां से हेयर लॉस स्टार्ट होता है, फ्रंटल लाइन से हेयर लॉस स्टार्ट होता है, फिर वो पीछे तक चला जाता है, और फिर that can occur complete alopecia. Okay, so here in female we will see the hair loss will start from partition side, then it will cover frontal and vertex position, and slowly at the end of stage you can say hair loss can be seen and front line also, but it is very at the end of stage. Okay, now we go for male hair loss pattern. So friends, here you can see male pattern baldness. So generally in males we named as Hamilton pattern hair loss. Female में था Ludwig pattern hair loss. Here you can say Hamilton pattern hair loss. Females में front line maintained थी, but in males you will see that it will start from front line, and this front line will exceed totally backward. This front line will exceed totally backward. My dear friends, we can see mostly hair loss in frontal region, where we can see in frontal region. Sometimes we can see hair loss also in temporal region. So my dear friends, this is hair loss pattern for male and female. फीमेल में हमने बोल दिया लडविग, मेल में हमने बोल दिया हैमिल्टन। फीमेल में फ्रंट लाइन मेंटेन थी, मेल में फ्रंट लाइन मेंटेन नहीं है, हेयर लॉस वहीं से स्टार्ट होता है। ओके माय डियर फ्रेंड्स, and a special condition associated with hair loss, that is androgenic alopecia. Androgenic alopecia, it is a condition associated with excessive androgen. Okay, in this an important or potent role is played by DHT, dihydrotestosterone. It is an important role playing for hair loss by secreting excessive testosterone in males. Okay, excessive testosterone जब male में secrete होगा, then you can see a condition that is associated with DST and androgenic alopecia. It's his name. Okay, so my dear friends, ये term clear हो चुकी है। अब hair loss को treat करने के लिए generally हम topical treatment कौन सी use करते हैं, वो है minoxidil. Minoxidil क्या है, वेल प्रेफर्ड। ओके, सबसे ज्यादा प्रेफरिंग जो ड्रग है टॉपिकली जो हम यूज कर रहे हैं वो क्या है, मिनोक्सिडिल। मिनोक्सिडिल क्या है, सबसे ज्यादा प्रेफर्ड ट्रीटमेंट है किसके लिए, हेयर। एंड इन सिस्टमिक ट्रीटमेंट वी यूज फिनेस्ट्राइड और डटास्ट्राइड। सो हेयर लॉस की ट्रीटमेंट क्या हो गई, टॉपिकल में मिनोक्सिडिल हो गया, और सिस्टमिक में फिनेस्ट्राइड या फिर डटास्ट्राइड यूज करेंगे हम। ठीक है, ये बेसिक ट्रीटमेंट है फॉर हेयर लॉस, जो कि हम यूज कर ही रहे हैं। जनरली मोस्ट प्रेफर्ड ट्रीटमेंट होती है मिनोक्सिडिल की टॉपिकली। सो माय डियर फ्रेंड्स, हियर ऑन दिस पेज यू कैन सी 3 images in front of you and you have to spot correct answer for these images for these conditions. So first condition, it is Alopecia areata. पहली कंडीशन क्या है, Alopecia areata. Here you can see patchy hair loss in shape of oval patchy hair loss. Second condition है ophiasis. Second condition क्या है, ophiasis. And third condition है cis CFO. Here you can see hair loss till started from front line and it is totally gone for complete frontal area. Okay, so frontal area, front line extended totally to backward side, and also you can see hair loss in temporal region. So my dear friends, here you can see three images. First is diagnosed as alopecia areata, second is psoriasis, third is sesapio. Okay, now let's discuss about classification of alopecia. Alopecia, it is classified into scarring and non-scarring condition. And here you can see classification for non-scarring condition. Non-scarring condition, it is divided into primary and secondary condition. In primary condition, you can see anagen effluent, telogen effluent, alopecia areata, Androzenic alopecia, Trichotillomania, tractional alopecia or hairstyle alopecia. You can remember primary condition by Tata. You can remember it by Tata. T. Okay, T. And in between you can add A. So by A you can remember anagen, alopecia, androgenic. By T you can remember telogen, Trichotillomania, tractional alopecia. Okay, Tata. And here secondary condition can be remained by sky. Okay, SLE, secondary syphilis, you can see moth eaten alopecia. We are going to see about this condition also. Hypothyroidism, hyperthyroidism, hypopituitarism, deficiency of iron, zinc, biotin. Okay, so you can remember this primary and secondary condition by Tata Sky. So my dear friends, alopecia is also classified. Images are also done. Now let's go to our next condition based on the image. Here we go. You have to pick out a correct answer for this condition, my dear friends. What do you think? What will be correct answer for this condition? My dear friends, this condition is DLE, discoid lupus erythematous. It is scarring type of alopecia. DLE क्या है? Discoid lupus erythematous है, और ये क्या है? Always scarring type of alopecia है. क्या याद रखना है इसमें? Discoid lupus erythematous, it is always scarring type of alopecia. Here you can see hair loss with scarring. Hair loss with scarring is present here. You can see this condition is also associated with mostly with the skin. Okay, hair loss होगा, but इसका मेन कनेक्शन किसके साथ होगा? स्किन के साथ. स्किन पर क्या देख सकते हो आप? स्कारिंग देख सकते हो माय डियर फ्रेंड्स. यू कैन सी ऑन स्किन स्कारिंग. ओके माय डियर फ्रेंड्स, सो डिस्कोइड ल्यूपस एरिथेमेटस क्या है? Always to be said as scarring type of alopecia. SLE क्या है? SLE क्या है? वो स्कारिंग होता है और नॉन स्कारिंग भी होता है. इनिशियल में क्या होता है? SLE नॉन स्कारिंग होता है, लेटर स्टेज में क्या होता है? स्कारी हो जाता है. सो माय डियर फ्रेंड्स, जो मेन डिफरेंस है SLE और DLE में वो यही है कि DLE ऑलवेज स्कारिंग रहेगा. SLE क्या होता है? इनिशियल में नॉन स्कारिंग, लेटर इट विल गो टू स्कारिंग कंडीशन, बट लेटर इट विल गो. ओके, सो माय डियर फ्रेंड्स, आई थिंक DLE और SLE में डिफरेंस भी क्लियर हो चुका है. So my dear friends, as I told you, DLE, discoid lupus erythematous, it is always scarring alopecia. ये क्या है? Always scarring alopecia है. Occurs commonly in sun exposed area. You can see here hypopigmented lesion with hyperpigmented margins because it is scarring alopecia. And important sign associated with it is carpet tax sign. You can treat it using hydroxychloroquine. ओके, इसका ट्रीटमेंट क्या है? हाइड्रोक्सोक्लोरोक्विन. शुरू में हमने साइन पढ़ा था, वो था फ्रायर टक साइन एसोसिएटेड विद ट्राइकोटिलोमानिया. लेट्स गो टू अवर नेक्स्ट. So my dear friends, here you can see condition alopecia areata. Alopecia areata क्या है? एक ऑटो इम्यून कंडीशन है. पैची हेयर लॉस होगा ओवल शेप में, जो कि मैं बता चुका हूँ. एंड ऑन एग्जामिनेशन दिस पैचेस विल शो यू एक्सक्लेमेशन साइन. आई थिंक एक्सक्लेमेशन साइन से आप वेल नोन हो कि एक्सक्लेमेशन साइन क्या होता है. ओके, लाइक दिस इट विल बी, and you will see the hair will start turning gray, एलोपेशिया टोटलिस क्या है, यहाँ पर कुछ कंडीशंस है उनके बारे में हम जान लेते हैं. एलोपेशिया टोटलिस when the hair loss is almost total, or you can say total loss of scalp hair. Alopecia universalis, loss of whole body hair. Ophiasis, alopecia along scalp margin, जो इमेज हमने देखी थी. Sesafio pattern, Sisafo pattern क्या है, हेयर लॉस पेड द साइड एंड बैक ऑफ हेड. सो फ्रंटल रीजन से स्टार्ट हुआ था, बैक हेड तक हेयर क्या हो चुके हैं, लेस हो चुके हैं. ओके, हेयर क्या हो चुका है, लॉस हो चुका है वहां पर. टर्निंग ग्रे फिनोमिना, इट इज ड्यू टू स्पेयरिंग ऑफ ग्रे हेयर्स, और यू कैन से डिस्ट्रक्शन ऑफ melanocytes. So my dear friends, regarding alopecia areata, an important point is also swarm of bees sign. It is seen on during histological examination. Swarm of bees sign क्या है, it's like hair loss and you can see spots here like a spots for bees. Okay, जो मक्खियों का छत्ता होता है उसके अंदर जो पोर्स होते हैं उस टाइप का कुछ हेयर लॉस है यहाँ पर. यू कैन सी इट एज पेरीफोलिकुलर हेयर ग्रेन्यूल्स और पेरीबल्बुलर lymphocytes as shown on histological examination. So you have to remember swarm of bee sign, it is associated with alopecia areata. आपको याद यही रखना है. ओके माय डियर फ्रेंड्स, नाउ लेट्स गो टू आवर नेक्स्ट कंडीशन. Here we go. Here you can see an image and you have to diagnose proper this image. So my dear friends, the correct answer for this condition will be moth-eaten alopecia. It is due to secondary syphilis. It is due to secondary syphilis and it is non-scarring alopecia. And we can see this case with history of incomplete treatment of genital ulcer. Okay. So mostly we see this condition with history of incomplete treatment of genital ulcer. So moth eaten भी देख चुके आप, यहाँ पर hair loss के पैटर्न देखो जरा. Moth eaten pattern hair loss. Okay, so little patches you can see here. This is said as moth eaten alopecia. So my dear friends, now go to our next. So my dear friends, our next condition is tinea capitis. What is tinea capitis? It is a kind of fungal infection. You can also say it as an infection caused by a ringworm. Okay, it is an infection caused by a ringworm, and mostly the fungi which are involved in this are trichophyton or microsporum. So trichophyton, it is a most causing agent related to tinea capitis. Tinea capitis क्या है, एक fungal infection है where you can see scarring and non-scarring hair loss. And here in this image we are going to see non-scarring hair loss, and here you can see two condition, carrion and favus. You can also say favus and scutula. Okay, you can also say it as scutula. Carrion, in carrion we will see bogey shaped hair loss, and you can see that in the condition of carrion, the trichophyton or the causing agent, that causing agent is invaded till lymph node. We can see in this condition that lymph nodes are inflamed. The glands covering lymph nodes are inflamed, and the agent causing agent is trichophyton mentagerophytes, and this condition most commonly seen in childs. Favus, here you can see cup shaped scutula or cup shaped hair loss, and here you can see the important feature is crusting. Crusting is important feature here, and it is caused by, the causing agent is here Trichophyton sconleni. Trichophyton sconleni, and is most commonly seen in adults. So my dear friends, this is end of our session. I hope that you all enjoyed this session. We discussed today dermatology on the basis of image, and this all. So my dear friends, thanks to everyone. If you feel that this video is helpful, then don't forget to subscribe my channel, share this video, like this video, and press on notification bell icon for getting updates for all upcoming videos. I hope that you all enjoyed this video session. Today we discussed many images These images, all images are anyhow or asked in previous years एग्जाम. ओके, जितनी भी इमेज हमने डिस्कस की है और या फिर जितने भी टॉपिक हमने डिस्कस किए हैं वो कहीं ना कहीं प्रीवियस ईयर से लिंक्ड है और ये इम्पोर्टेंट टॉपिक है हमारा डर्मेटोलॉजी का जिसको हमने आज डिस्कस किया है. सो माय डियर फ्रेंड्स, stay safe, stay healthy, and if you feel that this video is helpful, then don't forget to share this video.